The opinions expressed on this program represent the viewpoints of individual authors or contributors and do not necessarily reflect those of Troy University.
Hello and welcome to EconVersations. I'm your host, Dr. Dan Sutter of the Johnson Center for Political Economy at Troy University. Our world changed in almost inconceivable ways beginning in March 2020 as our nation took steps to battle the spread of SARS-CoV-2, the virus that causes the illness COVID-19. These actions altered our lives and abridged our freedoms in very significant ways. State shutdowns of businesses and stay-at-home orders caused a sharp decline in economic activity and sent the unemployment rate to levels not seen since the Great Depression. States have begun relaxing their restrictions now. How should we think about the shutdowns today, and what should we expect going forward? Joining me on EconVersations today to discuss these crucially important questions is my colleague from the Johnson Center, Steve Miller, who is the Adams Bibby Professor of Free Enterprise. Welcome back to the show, Steve.
Thanks, Dan.
And so we're going to be talking about a number of topics related to this, but we'll just mention ahead of time that some of this will be some numbers, some research that you'd put together for the American Institute for Economic Research a week ago or so, right?
That's right.
So this is a topic a number of us have been writing about and obviously researching or looking at over the last several months as it's been going on in real time as well. So the world's very different now. We have to wear masks many places. We see as schools got closed and our college courses moved online. So, as we start to think about this, I mean, the government's taken a lot of actions, some of which are completely new and some of which have some roots in the past. And so if we think about these actions, they sort of exist. They are kind of actions that governments, even in a free economy, like a free society like ours, could take. It's related to what's known as the police power.
Right.
And so tell us a little bit about, in a nation where we think we normally enjoy a lot of freedom, you can have these restrictions on freedom that the government can impose from time to time.
Right, and it's generally things that the government does in the name of public safety. I mean, for a long, long time, governments have enforced quarantines. Certainly government has been involved in terms of helping to find ways to provide more emergency medicine aid. Mm-hmm. And that includes things like, expanding the ability of hospitals to treat people mm-hmm. In a variety of ways. Sometimes that even involves setting up school gyms or auditoriums or things so that people can be treated, so that more people can be treated in an emergency. So there's a number of things that the state has done in terms of enforcing quarantines, in terms of expanding access to testing, and especially on the funding side, funding more efforts to help treat and deal with and control the spread of an epidemic.
And it's important that what we're going to be talking about today primarily are going to be the government policy responses, because we could also talk about how we as individuals might respond to protect ourselves or protect our families. So that's an important difference, isn't it?
Yes, it is. And there are actually more examples of that than I think people realize. That before states started issuing stay-at-home orders, before there were any requirements by governments to wear masks, or really even before businesses were requiring people to wear masks, you saw people wearing masks in public mm-hmm. on their own individually. You certainly saw efforts at social distancing individually where people just thought, maybe mm-hmm. I'm not going to shake hands for a while, maybe I'm not going to be more than I'm going to make sure I'm more than a few feet away from mm-hmm. anyone I interact with. So a lot of those are kind of voluntary and organic, and some of that happens anyway, even right. without any government edict or government enforcement. Another thing that happens, though, is that a lot of private businesses, because of concern for their employees and their customers, are going to start enacting some of these rules on their own. Mm-hmm. So, for example, before there was a mask mandate in Montgomery, Costco and other retailers were requiring that customers wear masks, and they've been requiring for a long time that employees mm-hmm. wear masks. And many employers are testing their employees very regularly now.
So this is a distinction that we're talking about, but there was a significant government response, and one of the things that is necessarily about a government response is that it largely has to be a common response. That whereas for individual responses, if I'm more concerned about the virus than you are, then I can take more safety precautions. But
Right.
when I'm more cautious, or like if I stop traveling or don't want to go out and leave my home at all, that doesn't impose on you directly. But government policies are going to be sort of like one size, largely going to fit for all of us.
Right, and we'll probably talk about this later, but they're also going to tend to be more geographically broad. You know, it will be for an entire city, an entire state, not a specific area, specific neighborhood, or a specific town where there may be an outbreak.
Now, mention that we had a wide range of policies imposed within a relatively short period of time, everything from travel restrictions internationally, restrictions on travel for state employees, even like restrictions on travel between states within the United States, so the stay-at-home orders, business closures, and some of them have long histories in the U.S. And so, especially business closures, although we hadn't seen a lot of that recently, there's some history of that from the Spanish influenza outbreak of about 100 years ago, right?
Yes, and a number of cities, Denver was one example, Philadelphia was another example. They had pretty strict curfews and pretty wide quarantines, where they were often quarantining many people or ordering many people to be quarantined. Curfews where businesses were required to close early. It's very interesting, though, that when you look at those cases, things that are now unthinkable during a very bad pandemic still happened. So, people still went to little cafes and restaurants indoors and kind of in close contact during the day. It wasn't that level of a shutdown. It was more about taking the sick and segregating them, but also major events where people would be in close contact with each other were canceled.
Yeah, I remember I was reading about this. The Stanley Cup Finals were not completed that year, but they were certainly they were in the midst of playing them before the teams were literally too sick to continue, and they had to halt the play, and it wasn't completed. So it was in many ways a very different response. But there were some things, and I think the states have quarantine laws on the books, and so these are things that have existed for many times. But one thing that was different this time were these stay-at-home orders, and tell us a little bit about how that's different than isolation or quarantine.
Well, so a stay-at-home order is telling everyone, whether they've been in contact with someone who's been infected, whether they are infected themselves, it's telling everyone that their top priority is to stay at home. And then, 43 states had stay-at-home orders in April, at least. And during those stay-at-home orders, virtually every state had a long list of exceptions to that stay-at-home order. So you were allowed to go to the pharmacy. You were allowed to go to seek medical treatment. You were allowed to go to the grocery store and buy food. But the idea of the stay-at-home order was that you were not supposed to be leaving your home without sufficient reason, that it was to only engage in essential activities.
Yeah, and these controls being put on persons who were not either sick or having been exposed.
And applying
was something that
applying
was
to the
quite
whole
new.
population, essentially.
And then another thing that is different is that, again, we've seen school closures. In fact, even in recent years, sometimes you'll see a school district or a school that closes when they have the flu really bad during the winter. But we saw widespread and very lengthy, and compared to other instances where some of these measures have been taken in the past, they're very much more, very longer, very more open-ended, right?
That's right. And they may say we're going to do this for 30 days and then reevaluate, but generally it's until you hear something different. Here's a stay-at-home order, here are the restrictions, and it affects everyone.
Now, I mean, different people are going to evaluate, the impact of this virus and the illness differently, and especially since there's a very targeted group of individuals who are susceptible to serious health effects from the virus. So I don't want to get into trying to debate which way different people should evaluate these. But there is one argument that we've heard in a number of different cases in the media and from politicians that from an economic standpoint we really don't like. And that is when, this is Andrew Cuomo, the governor of New York, because he made several statements along this effect of saying, like, if these measures save even one life, they will be worth it. And we, as economists, we really cringe when we hear that, right?
Right, and that's okay, because I think most people cringe when they hear economists' response to that. But the reason economists cringe is because the question that comes up in response to a statement like that is always at what cost? Saving lives is a noble goal, but it always has some cost if you're talking about saving more lives than are currently being saved. Mm-hmm. And it's because resources are scarce, right? And that includes resources related to health and health care. Mm-hmm. So there actually comes a point where saving more lives is almost nonsensical. You could be saving more lives, but you'd be costing other people their lives at some point if you just kept trying to save a certain group of people's lives.
Yeah, I mean, one of the first things I think we always try to get through to students in principles is that we live in a world with trade-offs.
Right.
And there are costs to everything. And, and you said that there are very real costs, and we've seen some of them already, with hospitals being told not to have elective or non-essential surgeries, which meant that people weren't getting cancer surgeries that they needed. And this comes down to a risk trade-off, right? The law, these actions may not even be, it may be causing other deaths that we might not see.
Absolutely. I mean, and anything that was considered an emergency or life-threatening, was allowed, but the thing is, healthcare is much more complicated than that. There's a lot of healthcare that people receive that they weren't receiving during shutdowns that is preventative or that is important for detecting something that is life-threatening. So there is always a trade-off there in terms of rationing healthcare and rationing health services.
And we're not going to go into this today, but I mean, economists could even we've developed something called the value of a statistical life, where we could put like a dollar value on lives that might be saved, and we can even go further and look at like years of life saved or quality adjusted years of life saved. But when we try to put all the different, benefits and costs in dollar terms, we're not necessarily saying that like lives are just come down to money. It's we're using dollars in a different fashion here, right?
Right. I mean, we're using money as a unit of account. We're using dollars as a way to count and make comparisons. But maybe, if anything, we kind of think of it the opposite way, that it's not that lives can be reduced to dollars. It's that dollars have an impact on people's lives, right? And if there's enough lost income, or if there are enough medical workers furloughed, or if there are enough people who are depressed, or if drug use expands, that also costs lives. And it could be traced back to losses of income, losses of dollars made.
And making sure that we see, we take actions to try to save lives, trying to make sure we see the other consequences that is a fundamental part of economics, right?
Right, but it's not very comforting, is it? I mean, the lesson is that you can only do so much good, unfortunately, and there are some harms that you're choosing which harm to accept.
One of the things that became very apparent as shutdown and staying home and business closure orders remained in effect was that these orders were having a significant economic impact on both the businesses closing and people losing their jobs, right?
Yes. So especially in terms of employment numbers, Robert Hughes at the American Institute for Economic Research, he's the one who does the macro data gathering and forecasting. And he just has an article up today where the total numbers he's reporting are 47.5 million unemployment claims over the last 14 weeks, which is since mid-March. To give that some context, at the height of the Great Recession 11 years ago, the number was around 15.4 million unemployed at once. So, I mean, to have this many claims active is rather striking. That's a very profound effect on the employment market.
Because I mean, there's about our labor force total is about 160 or 170 million people. So you're talking about like a good quarter of the people who were working, as of the beginning of March, have lost their jobs.
Right, and that's a rather striking number. Now, the good news is that the way the math works, at the end of the year, the annualized unemployment rate probably won't be anything like 20 or 25%, but it will still be high. It will be in the double digits, and it will be historically significant. I mean, we've had decades and decades now of, on average, very, very low unemployment, the Great Recession being an exception. And so far, this seems to be much higher unemployment numbers.
Yeah, because I mean, in my lifetime, the highest unemployment had been, I believe, like 10.8% in 1982, that recession. The Great Recession, it got up to 10%. But in April, I guess it jumped up to over 14%.
That's right.
And then even then, there might have been some question about the numbers not being calculated quite correctly.
I mean, and now we're wondering if it's maybe 17 or 18, something like that. But the rate of increased unemployment claims is slowing down. So I guess if you want to find some good news there, it is that it seems to be slowing down the rate at which people have lost their jobs.
And one of the good news that we saw in May is that some of these people who have lost their jobs have already been called back or have gotten their jobs back as the economy begins to reopen.
Right.
And as we reopen, then people are worried that we're going to see the infection, the number of infections go up as we reopen. In Alabama, we've had an increase in the daily numbers of infections, and as you mentioned, that prompted Montgomery to enact a requirement that people wear masks.
Right.
So is that really the right way that we should be thinking about reopening in this case?
Well, I mean, I really have two comments, which is number of infected isn't the same as number of cases. What's commonly reported in the media is the number of cases, and there are a lot of reasons why that's not the true number of infected. I mean, it's people who tested positive, and that's not capturing the whole population. That's a bit of a quibble on what the numbers mean, but the number of cases is not the same as the number of infected. But the thing is, you would expect the number of infected to go up, right? As people start interacting more with each other, that is the idea, is that you're reopening and you're making a trade-off. You're allowing more economic activity, you're allowing more economic recovery, because you believe that allowing some spread of infection to continue is worth it. It's a trade-off.
To some extent, many people saw those unemployment numbers go up and reacted very negatively to that. They said, like, the price we're paying here is too high. And if, in some sense, and especially in states where there hadn't been very many, many cases of the virus, you could argue that we had too strict of rules in place.
Right. Well, I mean, one thing that's possible is that there were states where in March there was already a very bad outbreak, in terms of the effect of the pandemic, and it was having a very significant effect in March and early April. But then there were other states, and I think Alabama is one of them, where the effect was actually very small in those early weeks, and it may have made more sense to impose the stay-at-home orders and the other policies a little bit later in the states as the virus spread across the country.
Yeah, and also you look at school closings or restricting hospitals or restricting surgeries. In Texas and in other states, there were stories of nurses being furloughed at hospitals because they weren't conducting these non-essential or elective surgeries, and they didn't have the near to the number of expected COVID patients, right?
Right, and they probably had less demand for other services as well. I mean, if there's less traffic on the road, less people at work, fewer people are doing home improvement projects if they're limited in terms of their ability to go and buy the materials or make those investments. I mean, just think about that if there's less activity generally, then there are going to be fewer injuries, there are going to be fewer people catching other illnesses from each other. So it actually led to virtually empty hospitals in some parts of the country. Meanwhile, in the Northeast, you have a healthcare system that was on the verge of being overwhelmed.
Now, we can look at numbers of cases, but there's also other things like hospitalizations that are relevant, right?
Yes.
So tell us a little bit about what's been happening with hospitalizations.
So my own view is that hospitalizations is the most important number to look at. And we can talk about why maybe a little bit, but, but the basic idea of why hospitalizations are important is because that's the real rationale for all of these policies. That's the real rationale for a stay-at-home order, or it's even the rationale for masking or social distancing. The rationale is to keep the infection rate spread low enough, or not low enough, I should say slow enough, right? To slow it down so that hospitals aren't overwhelmed, so that healthcare workers aren't overwhelmed with the demand all at once. It's to spread it out, right? Well, the reason hospitalization numbers are important is because they're telling us less about the spread of the virus, but more about the impact of the virus. How many people is the virus making so ill that they have to be hospitalized and are putting a real strain on the healthcare system? And those numbers have been declining nationally since mid-May. Now, if you look at the states, you see a bit of a different story. It does depend on which state you're looking at. But it's still, the reason the national trend is what it is because most states are seeing declining hospitalizations. So if you look at the 50 states, about 30 states, plus the District of Columbia, are seeing a decline in hospitalizations, and that's driving the national trend. There are about 10 states or so that are seeing some sort of increase in hospitalizations. Some it's a very clear increase, others it's just a hint of maybe an increase, like South Carolina or Alabama, you're seeing maybe a hint of an increase at the moment. And then there are maybe 10 states where it's just a flat trend. And sometimes the numbers are very small. So if you look at a state like Hawaii or a state like Maine, you know, the reason it looks like a flat trend is because it's such a low number of total people in the hospital. I mean, there are some states where we're talking about there are people being hospitalized for COVID, but it's maybe 15 or 20 people in the entire state who are being hospitalized. And
when we had such a high peak there, I mean, to some extent, the idea of flattening the curve is literally what we see here, this idea that the number of hospitalizations actually peaked and started to go down, and it has been at a lower level, and one where the healthcare system isn't being overwhelmed. All of our non-pharmaceutical interventions, these different policies that we're talking about, like I said, they're just there to flatten the curve, or really sort of prevent the healthcare system from being overwhelmed, because then you might actually have extra deaths from people not being able to be treated.
Right, they're not intended to stop the virus or eliminate the virus. They're intended to slow the spread of the virus down so that we as a society can deal with it better. So there won't be excess deaths due to people not getting sufficient medical care. It's not to really prevent the deaths that the virus would cause on its own. It's to spread it out, right, over a longer period of time. And that means that the virus will hang around for a longer period of time. So some people would say, well, you know, there's a slow decline in deaths and a slow decline in hospitalizations, but that makes a lot of sense that it would be a slow decline because that's been the strategy all along, to slow down the spread of the virus.
So to expect like zero hospitalizations would be an unrealistic thing as we reopen the economy. It's more to just keep them under control.
Right.
Another thing that's relevant here, and President Trump has launched what he calls Operation Warp Speed to try to rush a vaccine against COVID-19 to the market. How would a vaccine or medicines to effectively treat the illness affect our discussions here? Okay,
well, so we're in kind of an interesting spot in terms of like history of vaccines. So in the 20th century, in the middle of the 20th century, or really from 1955 or so to about 1990, it was kind of a golden age of vaccines where there were, dozens of vaccines that were created to deal with viruses that had been killing and injuring human beings and severely harming human welfare for a very long time. So, I mean, you had a number of very important vaccines come along, and think of these as the vaccines that if you have a child that goes to the doctor, right? That when you have a young child, think of all the things that they're vaccinated against. There's measles, mumps, rubella, smallpox, right? Polio, right? So it's a number of viruses like that where people are getting these vaccines. But those vaccines are, in terms of human history, a very recent development. And they took years and years and years to develop. So, for example, if you think about other coronaviruses, other novel coronaviruses like SARS and MERS. So SARS came along, I think, in around 2002. And so far, the vaccines that they have tried to create don't seem to substantially reduce or eliminate, or they don't prevent infection very effectively. So they're still working on that. MERS is more recent. MERS was, I think, 2012, so it's been 8 years, and just this year, just in April of this year, they're starting to do human trials with some of the candidates they have for vaccines there. So it's usually a lengthy, many-year-long process to develop a vaccine. But the good news is, if you have the right kind of a vaccine, if you only have a partially effective vaccine, that's one thing. We can maybe talk about that in a second. But if it's a fully effective vaccine, if you think of it as being like the polio vaccine, you can more or less eradicate a disease in a country if you have a vaccine like that.
And so that would be extremely valuable if it should work. And then I'll just mention, I mean, I think the last I saw, there's somewhere around 100 different candidate vaccines in development across the globe. So certainly there are a lot of medical researchers out there who think that they've come up with something that might work in these cases. I guess we have to wait for testing to see if any of them will actually work. But I guess last thing I want to touch on here would be the possibility of if we don't have a vaccine or enough cure, then we could be in for a longer haul. And some people have looked at how Sweden has approached the COVID crisis, and it's been very different. And so you can tell us a little bit about that and why that approach might have some relevance for us going forward.
Right. So Sweden's basic strategy was to look at what they thought the capacity of their healthcare system was to handle the pandemic as it spread through their country. And their goal was to keep things as open as possible while limiting the spread of the virus or slowing the spread of the virus to stay within that constraint of their healthcare system's ability to handle it. And on that measure, they pretty much succeeded. So they did have some, I mean, there certainly was encouraging of social distancing. There certainly were, schools were closed for a period of time. I mean, there were some measures taken in Sweden to control the spread of the virus. It wasn't just let it go. But their goal was to not overwhelm their healthcare system, and they pretty well succeeded in that. And what that means is the outbreak in Sweden, it looked initially worse than it did to some similar countries, but overall it seems to have passed through the country more quickly, and they've done far less harm to their economy.
Yeah, I saw in the first quarter, Sweden's economy actually expanded, which is different from many of the other countries. And then I guess the important question might be going forward, if it is a long haul, do you need a softer touch or a policy that's more sustainable in the long haul versus what we've tried when, pretty much had to give up after a couple of months because people thought that the costs were too high. Well, thanks for coming on and talk about this, and thanks for joining us. Join us again next time for another EconVersations.